Hello, I'm Dr. Vahid Behravan. I'm a neurologist with TeleSpecialists, and today I'm joined by two of my esteemed colleagues, Dr. Jessica Floyd and Dr. Theresa Sevilis. Dr. Floyd is a neurologist and fellowship trained in clinical neurophysiology, and Dr. Sevilis is a neurologist and fellowship trained in vascular neurology. Both doctors have extensive experience in telemedicine and teleneurology in particular. We will start with Dr. Floyd. I want to ask you about this. How does telemedicine benefit the community during this crisis?
Good question. So, as everyone is aware, the healthcare system has changed extremely during this time of crisis with this infectious disease. What telemedicine is doing is it's allowing continuity of care between specialty physicians and patients, regardless of where they are and what they need. So I think it's doing a lot for our community in terms of keeping up the confidence that someone can come to the hospital and get the care that they need when they need it, in particular in emergency situations. But also for physicians and facilities, they know that they can maintain a high level of care, getting specialists into their facilities, even at a time where there's a crisis and a need for getting physicians nationwide.
Thank you, Dr. Floyd. Dr. Sevilis, how does this pandemic affect stroke patients in particular in the community?
That's a good question as well. One of the biggest concerns we have with stroke patients and the pandemic is the stay-at-home orders. Many people are now afraid to come to the hospital when they're developing symptoms because they're afraid that coming in is going to actually be what gets them sick. And that we all know stroke doesn't go away, but yet we're seeing far less patients show up in the hospitals across our country, across the world with stroke-like symptoms. And we certainly know that strokes does not go away because there's a pandemic. So the most important thing is to urge people in the community to still come and see us when they have a stroke. You know, back in the 1918 pandemic, stroke was the #2 killer of Americans, and we've gotten it down to #5. I'd hate to see this pandemic have a negative impact on all the progress that we've made in stroke care. So one of the important things for patients to know is how to recognize stroke. And same in or not in a pandemic. One of the best acronyms we have for that is something called B FAST, where B stands for balance, so sudden onset of imbalance or dizziness. E stands for eyes, so if you have sudden vision loss or double vision. F is for face, a facial droop. A is for arm, so arm weakness. And S is for speech, and T is for time, because time is critical for getting patients in so that we can help them.
Oh, interesting. So has COVID-19 actually affected the incidence of stroke?
And we don't have a lot of data on that quite yet. There is a lot of research going to look into that, and we certainly are seeing stroke patients within the COVID population, and we know that it can happen in the more severely affected patients, but whether it truly is a higher incidence, it is not really clear at this time yet.
Thank you, Dr. Sevilis. Dr. Floyd, how does telemedicine benefit the healthcare providers in the pandemic?
Yeah, good. So telemedicine can do a lot for healthcare providers. As a neurologist, what it's allowed us to continue doing, for those of us that have been in telemedicine for quite some time, is we've somewhat continued business as usual. We show up, we have systems set up, we're in hospitals, we can sign on 7 a.m., be there to see our patients, and we're working with the team, very flexible in our schedule so we can cover the patients when they're able, the nursing teams and the local doctors that we work with on site when they're able to round with us. And having that continuity has helped me as a neurologist to be able to maintain my service and what we're giving to our patients. For physicians that are in local hospitals that utilize our service in telemedicine, with TeleSpecialists in particular, we have hospitals all across the country. So we are able to really create this broad collaborative effort because we're able to, see what we're seeing in certain hospitals or certain neurologic presentations or how we're treating some patients, and then use that when we're seeing other patients, maybe even across the country, coast to coast. So we're really able to offer collaborative healthcare, physician to physician, able to work as a team together. We have a lot of different providers on at once, and we can bounce different ideas off of each other, reviewing the literature to try to see, are we watching out for or taking care of our patients as best we can? So telemedicine is a very big wave of technology that's been coming for quite some time, but now that we find ourselves in this COVID crisis, we're really seeing a lot of the bits and pieces that we've enjoyed in this practice really come in need and come to the rescue in this current crisis that we're experiencing right now, because it's very helpful in many different ways.
Very interesting. So to sum it up, we heard that infectious pandemic like COVID-19 create a challenge for patients and their healthcare providers, and telemedicine has become an increasingly valuable tool in providing quality medical care for patients in need. At the end, I wanted to thank you, Dr. Floyd and Dr. Sevilis, for joining me today and sharing your expertise and experience. And I also wanted to thank our other colleagues and staff at TeleSpecialists who are doing their best in these tough times to provide the highest quality of care possible for our patients. Stay safe and stay well.